Hi, my name is Dr. Evan Dunn. I'm a retina specialist and the co-founder of I Know More. This video is going to teach you everything you need to know about diabetes and the eye. The entire video will be approximately 9 minutes in length. Let's get started. We'll start off with a brief introduction to the anatomy. Here we can see a photo of a patient's eye. The cornea is the clear part. The iris is the colored part, and the pupil is the dark area right in the center. Looking at it in cross-section, we can see the cornea, the iris, the lens sits behind the pupil, and then behind the lens sits a vitreous cavity, and the retina is a film-like layer which lines the back wall of the eye, and that's the primary area that's affected by diabetes. Here we can see a photo of a patient's eye. The yellow disc-like area here is the optic nerve which connects the eye to the brain. The arteries and the veins is what provide blood flow to the retina, and the veins remove the blood from the retina and send it back towards the heart. The macula is the circular area right here, and this is the area that's responsible for all of the central vision. So now let's delve into the different stages of diabetes in the eye. But before we do that, we'll first talk about what you can do to prevent ever getting to one of those stages. Number one is blood sugar control. Clinical trials have shown us that the desired blood sugar level is an A1C of 7 or less. That is critical in decreasing the risk of diabetes in the eye developing or experiencing progression of diabetic eye disease. Blood pressure control is extremely important. Having elevated blood pressure above a goal can dramatically increase your risk of having worsening diabetic eye disease. Exercise has been shown to be quite helpful in decreasing the risk of developing or experiencing progression of diabetic eye disease. Eye exams are absolutely critical. The reason why is because detection of diabetes at an early stage can lead to better treatments, which results in better vision. So patients who have type 1 diabetes, it's recommended that those patients have a diabetic eye exam within 3 to 5 years after the onset of diabetes. Patients who were diagnosed with type 1 diabetes at age 10 or older are recommended to have a diabetic eye exam at the time of diagnosis. Patients who have type 2 diabetes are recommended to have a diabetic eye exam at the time of diagnosis. So let's jump in. So this is a patient who has mild non-proliferative diabetic retinopathy, which is characterized by these small microaneurysms, which are outpouchings of pre-existing capillaries. They may potentially leak and cause other issues, and we'll go into that in a little bit. This is a patient that has moderate non-proliferative diabetic retinopathy, and we can see that they have many more microaneurysms than we saw in the previous stage. They also have something called a dot blot hemorrhage, and that means that they have a little bit of bleeding within the layers of the retina themselves. This patient also has a separate issue which is called macular edema. So these microaneurysms can actually have some leakage of fluid out, and it can cause fluid to get within the layers of the retina, and as the fluid is absorbed, it leaves behind these proteinaceous deposits, which you can see in yellow, which are called hard exudates. These hard exudates can get in the central vision, and if they do, they can cause a permanent decrease in the vision. And we'll talk a little bit about that later. Fortunately, we can certainly prevent these from ever getting into the central vision and causing problems. This is a patient that has severe non-proliferative diabetic retinopathy. You can see that there's many more microaneurysms, and there's many more spots of blood. This patient has a 50% chance of developing what we call proliferative diabetic retinopathy, which means that new blood vessels develop. It's very important that you recognize this stage because these patients need to be followed closely. Now, this particular patient did have a separate issue, which is called diabetic macular edema, which is where there's swelling in the central vision, and they had to undergo treatment with something called an intravitreal injection. And what's interesting is that not only can it cause the swelling to go away, the vision to get better, but it can also cause the blood to go away. So we can see almost a complete regression of all the diabetic eye changes in this patient. And this patient did very well, recuperating a very significant amount of vision. So now let's talk about the next stage, proliferative diabetic retinopathy, and it's called this stage because there's these new blood vessels, which we can see here around the optic nerve, and they have a tendency to bleed over time. So our goal is to treat it before they bleed. And when they do bleed, they bleed into this gray area, which is called the vitreous cavity. It can really decrease the vision, sometimes to the point where if it doesn't go away, they actually need to have surgery. So here we have a patient who has panretinal photocoagulation for treatment. So here we have a patient that has proliferative diabetic retinopathy who's undergone treatment with something called panretinal photocoagulation. And this is an in-office laser procedure. And all these little circular gray areas that you're seeing here are all individual laser spots, and those laser spots cause the new blood vessels to start to go away. However, it does not cause any of the blood to go away. The blood actually has to be absorbed by your own body and fall to the bottom of the eye with gravity. So, the other potential treatment option for proliferative diabetic retinopathy is with intravitreal injections. And intravitreal injections is a treatment that works very well, but it has to continually be administered, really for a period of several years. And if patients miss treatments or kind of don't come back for appointments, the new blood vessels can come back, they can bleed, and they can actually develop other issues like scar tissue, and we'll show you that in this next picture. This is a patient who has something called a tractional retinal detachment. This is what happens if you have proliferative diabetic retinopathy and don't undergo treatment. The new blood vessels end up forming this scar tissue. It can actually pull the retina away from its blood supply and cause a permanent decrease in the vision. While surgically, we can go and remove the pulling force and allow the retina to settle down to where it was. Since it was pulled away from its blood supply, unfortunately it has a tendency to not see very well after. So now I'm going to show you a picture of a normal appearing macula. So the macula, as we mentioned, is the area responsible for all of the central vision, and we can see in cross-section using a special technology all of the different layers of the retina. And what I want to show you is that patients can actually develop swelling right in the center, and that swelling has a decrease in the vision. It's called diabetic macular edema. So here we can see this swelling, which you can see these black cystic areas represent fluid within the actual layers of the retina. And fortunately, we have excellent treatment for this. We treat these with intravitreal injections. Now, patients who have swelling that's not in the center, we can actually treat with a little bit of gentle laser. So what we do is just kind of real gently apply a little laser to these areas where the leakage is located, and that causes a swelling over a period of several months to decline. So in conclusion, diabetic eye disease is very treatable. Not only can most patients maintain good vision, but they can maintain excellent vision. If you'd like to read more about diabetes in the eye, please check out our website at iknowmore.com. If there are additional topics that you'd like discussed, just please leave a comment below and we'll try to address those in upcoming videos. You can do it. Thank you.